Greetings. We are here this evening with Dr. Klint Peebles, who is a board-certified dermatologist with Kaiser Permanente in Washington, D.C. and suburban Maryland. Dr. Peebles is also the immediate past chair of the American Academy of Dermatology Expert Resource Group on LGBTQ SGM Health. We are so happy to have you here with us this evening, Dr. Peebles. Thank you for joining us. And we are so excited to welcome you as the conference chair for our upcoming Sexual and Gender Diverse Dermatology Summit in Southern California, this October 15th through the 16th. What unique experiences do you bring to this conference, and why is this patient population so important in the dermatologic field?
Well, first of all, thanks so much. It's my pleasure. Thank you for having me this evening. I'm so excited about this opportunity to talk with you and to discuss this first of its kind programming dedicated to the health and well-being of sexual and gender diverse people. To answer your question, in some ways, this is actually very personal. My own experiences as a gay trainee in medicine and ultimately a physician showed me how deeply meaningful and important it is to build a community of inclusion and to ensure that no one's left behind. And when you don't see that being built around you and by the system that you're in, you simply do it yourself. And that's exactly what all the esteemed faculty taking part in this summit and me have done with our careers. It's been a focal point of our trajectories and our interests and our passions. And we recognize that not only is it important to know your dermatology, but also to know your patient and to have a command of the terminology and appreciation of the lived experiences of this important group within the context of cultural humility and structural competency. And also, time and again, our curricula have been shown throughout medicine, and dermatology is no exception, to be deficient in this content. We know that students and trainees generally do not feel comfortable caring for this population, and they don't feel equipped to do so. A major survey study in dermatology a few years ago showed that almost half of programs had 0 curricular hours dedicated to this content in residency, which is certainly something the field as a whole needs to work on. And to that end, we know that sexual and gender diverse people have negative healthcare experiences. Transgender patients are targets of discrimination during healthcare encounters. Almost a quarter of transgender adults have avoided necessary healthcare because of fear of mistreatment by their clinicians and providers. And rates of this mistreatment are especially high when we start looking at the intersection of other marginalized populations, such as on the basis of race or ethnicity with sexual and gender diversity. Among lesbian women, for example, fear of discrimination drives lower rates of Pap testing than those among heterosexual women, despite their additional risk factors for cervical cancer. And in general, sexual and gender diverse people have higher rates of cardiovascular disease, obesity, cancer, sexually transmitted illnesses, including HIV infection, HPV infection, syphilis, and hepatitis C. There's higher rates of many mental health problems, including depression, anxiety, and substance use. And in a major survey of the transgender population in this country, we saw a staggering statistic that that more than 40% had actually attempted suicide, which is just something huge to reflect on in a way that we can intervene for the better. And we know that part of the reason we have so many of these deficiencies is that data on sexual orientation and gender identity are not routinely included on major demographic surveys and clinical trials and other research mechanisms, and that's a huge problem. In 2021, there was a Department of Health and Human Services report that showed that sexual and gender diverse people were more likely than non-sexual and gender diverse people to delay care because of costs and to worry about paying medical bills. Almost 20% of them versus almost just 5% of non-sexual and gender diverse people delay counseling therapy because of costs. And so we would know much more about these disparities, and they would probably be even more staggering if we had the data and the education and all of these tools to help us better care for this population. So the sexual and gender diverse community is critically important. It's underserved, and those of us who have been invested in this work and have really fueled our passions in terms of taking the time and onus to learn more about these lived experiences and how we can help improve that care, and not only improve it, but to educate our colleagues, I think is going to be really critical. And it's definitely made our careers all the more satisfactory and rewarding.
Well, that is, I mean, just to say the staggering statistics that you just laid out really make it very evident that it's just an understatement that this is definitely something that needs to be out there in education. And I know LivDerm has obviously recognized that and moving forward with this program. And just so sad the numbers that you just shared, and obviously the way all of this affects mental health for every patient in this population. So thank you for really putting numbers behind it, because it's just a very big part of the reason for the need for this education. And I think our population and all of our audience needs to kind of hear about this, the need. So,
well, of course, and I just wanted to quickly add to that, based on what you said. I LivDerm has recognized this, and I really want to commend you and the entire LivDerm team for putting forward the energy and investment and time to really bring this issue to the forefront and have this dedicated, first of its kind programming. It's just so wonderful to be able to collaborate with all of you and to have this opportunity to really have this novel educational event. So thank you.
Absolutely. And thank you for leading it. Although there are certain aspects of aesthetic medicine in caring for the sexual and gender diverse patients, would you consider this area of the discipline falling under the category of medical dermatology, or is it not necessary to differentiate?
Yeah, it's a great question. I think both medical and aesthetic dermatology certainly apply when taking care of the sexual and gender diverse population. And absolutely, clinicians specializing in both will undoubtedly learn a huge amount from it. But as is the case with so many topics, words and terminology matter. And in terms of aesthetic medicine, I think it's important to be really clear that the conventional way in which we use the term cosmetics or aesthetics doesn't necessarily apply to gender diverse medicine and dermatology. In other words, the considerations, approaches, and techniques used to deliver something like botulinum toxin or soft tissue fillers to a person for the purposes of gender affirmation aren't necessarily the same as they might be for a person undergoing those procedures for purely cosmetic purposes in the way that we conventionally think of those. We know that minimally invasive procedures, such as those that I just mentioned, can, and should be an important part of gender affirmation options, especially when we, compare the risks and benefits and other considerations to more permanent surgical procedures. And being conscious of gender neutral terminology is really critical when having these conversations, not only with patients, but with other clinicians and providers and the public at large as well. So, I think this is a concern that comes up quite a bit. And it's not so much about kind of drawing that line in the sand, so much as it is simply contextualizing it appropriately and using the right words to describe what we're doing, and being sure that we're being cognizant with our words and procedures in terms of what the person in front of us is there for.
Absolutely. And you answered the follow-up question very well about whether, you can expect practitioners of both cosmetic and general dermatology to benefit from this. And I think you absolutely, covered that piece. I think both, it's applicable to both. And this is one of my favorite things to ask you. So your wealth of experience in leadership and advocacy in the field of better medical care for the sexual and gender diverse patient population has no doubt improved outcomes and quality of life. Can you tell us about some of your career highlights and moments when you could see actionable change as a result of your efforts?
Well, first, that's very kind and overly generous of you. It really takes a village, and really, my experiences have been, built upon those of others, and I stand on the shoulders of people who have mentored me, and most importantly, my lived experiences and the patients who have educated me. But I think a lot of this, goes back to many years ago when I became invested in working with the transgender population back in Tennessee, where I had attended both undergraduate and medical school at Vanderbilt. And I was given an award by the Tennessee Transgender Political Coalition during my time there, one of their annual awards for services. And that was one of the first instances when I kind of reflected on what I was doing and really saw that even the little things that we think don't matter, they actually do matter, and they have a huge impact. So, a lot of, more recently, I think I've been really privileged and honored and excited to have directed several symposia for the American Academy of Dermatology as part of its annual meetings related to education on LGBTQ and sexual gender diverse health and dermatology, and being able to put together these educational sessions and build a group of speakers that have so much of a wealth and breadth of experience with this population, and they have their own areas of expertise and great leaders in their respective fields and silos, I think has been very rewarding. And to bring this forward to the dermatologists in the country in general has been just such a great honor to do. One of the most rewarding events that I can remember would be when I was able to write a position statement with collaboration from a few of my peers. And this was about, a position statement dedicated to the health and well-being of LGBTQ and sexual gender diverse people in dermatology. And we brought that position statement forward to the executive leadership of the Academy at the annual meeting in 2019 in Washington, D.C. And I had the opportunity to present that statement to the board. And seeing the reception of that statement, and to see the stakeholders and support for that throughout so many pockets of the Academy was just really breathtaking in a way. And it was wonderful to know that we had that support and that the board was behind us, and that now these issues and our dedication to them are ensconced in the Academy policy. And I think it's just such a major step forward. And dermatology was one of the first specialty societies to actually adopt and take up that kind of a statement. Also, I was able to write a resolution that passed the American Medical Association House of Delegates pertaining to gender neutrality and risk evaluation and mitigation strategies programs that are required by the FDA for certain medications. And the one in particular that's relevant to dermatology that we think of most often would be the iPledge program for isotretinoin for the treatment of acne, which was very stigmatizing and discriminatory toward gender diverse individuals historically, because it conflated gender identity with sex assigned at birth. And now that that's changed as of last December, it's become a lot more accessible to gender diverse people. And that groundwork was laid when we were able to get that policy passed by the AMA House of Delegates, as well as other stakeholders, including the Academy, of course. But, I've given numerous talks to dermatology societies, student interest groups, academic departments, and grand rounds, national and international meetings, which is always rewarding to kind of spread this knowledge and awareness. But, one of the most significant things is simply mentoring students and trainees and seeing the next generation of clinicians invested in sexual and gender diverse health. I was just told a few weeks ago by a major leader in dermatology that after reading one of my published papers, she changed how she asks some of her intake questions in sexual and gender history, and has received tremendous feedback from patients. There's gender diverse patients that now want to go back to her and keep following with her, and that just makes me smile. This is what we're here for. This is what we're here to do. We want to ensure that patients are validated and affirmed, and that we are able to get this knowledge out, not only to people who are interested in this as a focal point of their careers, but for people who just want to be better dermatologists in every way. And we want to make sure this is accessible and rewarding and approachable and easy to understand and implement in their practices and in their lives, quite frankly, in terms of being more inclusive of everybody.
Sure, that's so much. And I feel like the academy piece, I got goosebumps. I couldn't imagine that feeling for you, but what you just mentioned at the end of that with, a top leader in dermatology and just in her own practice, doing this with her own patients, knowing that this is affecting actual live patients day in and day out in another practice other than yours. That's so impactful. So congratulations on all of your efforts. The Sexual and Gender Diverse Summit, which we're talking about, is taking place within SBS West Coast Derm, which is our first launch on the West Coast. It's this October 2022 at the Terranea Resort, and it's a milestone event for LiveDerm. Do you think that the location of that event just outside of Los Angeles, California, is indicative of the sexual and gender diverse population and the providers who see them? Do you see events like this someday soon being held in smaller, more rural regions of the US where fewer resources or social determinants may mean that sexual and gender diverse patients face even larger roadblocks to care?
Well, it's a good question. Certainly California in general, and especially the major metropolitan areas of California, have a very major role and position in the history of sexual and gender diverse activism and in being progressive when it comes to the expansion of LGBTQ civil rights and fighting for equality for this population and access to care. And just in general social support. And so certainly the state of California and places like Los Angeles and San Francisco, all of those locales have been very progressive and very accepting on so many of these issues. And while it is a very diverse population there, I think it is important, just as your question alludes to understand that sexual and gender diverse people are everywhere, right? There's no state, no city, no area that just has no sexual and gender diverse individuals. We live everywhere. And I think it's important to recognize that and to be conscious of the fact that they don't necessarily have to only live in blue states or areas that might be perceived as more liberal or something along those lines. And so to answer your question, I certainly hope that someday soon we will see this type of programming and these efforts extend and reach into, all sorts of underserved areas, whether that be rural settings or other underserved areas. We know that there have been disproportionate disparities recognized in LGBTQ populations who live in rural settings, where they don't have access to the services that are afforded by more urban settings. We know that, for instance, individuals living in areas, where there are a larger and broader intersectionality component, right, where there's, disproportionate issues of racism and other issues of discrimination. I hope that we can end up meeting people where they are and bringing this education and bringing these efforts throughout the whole country. Even, we know that individuals who are Indigenous and also identify as sexual and gender diverse have very substantially heightened disparities compared to those who are not. And I hope that, this programming might be able to reach Indigenous populations and tribal areas and to kind of reach people where they are. So, even though I think this is a wonderful first step, I really look forward to the day when we're able to see this content and programming and awareness basically come to every corner of the country, and of course everywhere in between, including the heartland and the South, where there are so many people who are in need. Even we've seen so much lately with regard to some of the legislation that is being passed or at least proposed to kind of limit access to care and limit the freedoms and liberties of LGBTQ people. And a lot of that is disproportionately happening in the South. And those are areas where there is, less opportunities for medical coverage, when it comes to the lack of Medicaid expansion, for instance, in many of those states, where we see that not only is there, more state sanctioned discrimination, but also less opportunities to access care and to get coverage. And so, a lot of work to do, but it has to start somewhere. And we just hope people leave this meeting able to carry these messages and this expertise and this passion wherever they find themselves.
Absolutely. There's so much more ground to cover. Couldn't agree more. In light of that, in talking about the future and things that, can use some improvement, is the field of dermatology seeing improvements in non-discrimination, acceptance, welcoming environments, affirming language, and dedicated initiatives to improve safety? And can you explain some of those efforts within the context of guidelines or policy?
Sure. And that's another, excellent and timely question. And I think overall we are seeing improvements, but I think the field in some ways mirrors the broader society at large, in the sense that, as I mentioned earlier, we are seeing some setbacks. There has certainly been more of an interest and an investment in diversity, equity, and inclusion initiatives throughout medicine, attention to language, ensuring inclusive environments for medical students and residents and the like. And that goes for not only medicine more broadly, but also for dermatology as well. But we need to ensure that our actions mirror our words. We need to be sure that, for instance, gender diverse residents are fully supported in their gender affirmation care during residency, and that departments are knowledgeable of the access to care that they do or do not have, and that this information is known during, resident recruitment efforts and interviews, and that departments are engaged in broader conversations with their medical systems about this care, not only on behalf of their own residents who may be going through a lot of these gender affirmation therapies, but also in terms of their own patients. And, as I alluded to, we also can't ignore that there are sweeping efforts across the country, if you've been paying attention, to interfere with and intervene in the practice of medicine, violating the sanctity of the physician-patient relationship and our autonomous evidence-based practice of medicine. We've seen numerous laws related to banning or outright criminalizing gender affirming care, which certainly affects dermatology, as well as efforts to exclude sexual and gender diverse people and their history from curricula, exclude transgender people from athletic participation, and the list just goes on. And with the recent Dobbs decision from the Supreme Court, depending on state laws, it may complicate our ability to offer contraceptive counseling and to also manage unintended pregnancies that may occur, for instance, when our patients are on isotretinoin, and this can be very relevant in the transgender population. So we have to understand that our practices are inextricably linked to the prevailing sociopolitical narratives that we're living in, and we don't practice in a vacuum. So advocacy, I would argue, is fundamental to what we do, and it's inherent to the practice of medicine. And we can't really claim to be, effective physicians for our patients when we're only thinking about medicine as just one thing within the confines of the walls of our exam room or our virtual environments. We have to think about the challenges that our patients are seeing across the board in terms of their everyday lives, and how, intrusions into their lives and their ability to safeguard their own health, especially to adhere to our medical recommendations, it can impact their own care and their well-being. And, I think even though organized medicine has made quite a few strides in recent years, especially in the last decade or so, from the American Medical Association all the way down to specialty societies in terms of promoting policies that are advancing this work, we still have a lot of work to do at the regional levels, the local levels, the departmental levels, the individual levels in terms of education and effective policy, and really moving this forward. At the end of the day, we can't afford to be complacent. And I think that's the big message. And even though we have seen progress, we have to not only understand that that progress is just the first step and it needs to go further, but we also have to be understanding of the fact that that progress can easily be reversed if we are not careful. And it doesn't take much to tip the scales in the wrong direction. And so I think that's why we have to really be invested in our education, educating the future generation of physicians and healthcare providers, and ensuring that our institutions and organizations have the right people at the helm that understand the importance of this work and that are going to advance it. And again, we hope that this summit is really going to inspire people across the board to get involved in this work and to keep it going in their own circles.
Absolutely. I think, like you said, there's been progress, but we're just scratching the surface. And, we're just so happy to have you be a part of LivDerm and have you lead this program, the first of its kind for LivDerm. So hopefully there will be so much more that comes from this, and so many things and good movements with all of the attendees that are with us in California that during that summit, and just really advancing everything that you've been behind and been working on so tirelessly for years. And I just want to thank you for your time this evening, for sharing all of this with us, and most of all for leading this amazing program and making it what it is, because you have curated this agenda and pulled together some of the best experts in the US that treat this patient population and that feel as strongly as you about the need for this education. So thank you again, Dr. Peebles. We truly appreciate your dedication in this.
Well, thank you, Laura. I can't wait.